And our third speaker is Ritika Devadas. So Ritika is a fifth-year medical student at the University of Edinburgh, and her interests lie in the influence of socio-economic and cultural factors on healthcare access and outcomes. And Ritika's going to share our talk with us this afternoon on the role of lifestyle medicine in the management of fibromyalgia. Welcome.
Thank you. Just find my slides here. They're just loading. Can you hear me okay? Okay, perfect. So hi everyone, thank you for having me. I'm Ritika, and today I'll be talking about the role of lifestyle medicine in the management of fibromyalgia. Before I begin, I just want to warn you, I tried my best to cut it within to the 10-minute time frame, but I think I will run a few minutes over. So, feel free to let me know to stop or anything. So what I'm going to talk about is what lifestyle medicine is, a bit about fibromyalgia's background and management, and also discuss the relevance and applicability of the 6 pillars of lifestyle medicine to the management of fibromyalgia. So lifestyle medicine is an evidence-based approach, and it uses environmental, behavioral, medical, and motivational strategies to manage lifestyle-related health problems in a clinical setting. And then these can then extend on to self-management within patients as well. It requires a multidisciplinary effort involving collaboration between clinicians, public health professionals, other researchers, and educators in order to find new evidence, share knowledge, and create change within patients and the general population. So traditionally, lifestyle medicine came about as a way to manage chronic diseases with modifiable risk factors, but its utility extends beyond this, and it holds potential for managing chronic pain conditions as well. By introducing practical approaches to daily life, it can offer a sense of agency and control over one's health, and these methods are designed to be achievable and sustainable through low cost and also low time commitment strategies. So the British Society of Lifestyle Medicine have outlined 6 key pillars, as you can see here. And while these may seem like, fairly simple advice or common sense, it's important to highlight to patients how they can directly relate to their health condition and the health outcomes, because a lot of people might not be aware of the details surrounding this. So I'll just go over fibromyalgia quickly. So as you know, it's a chronic pain condition, and it has a variety of symptoms, but it's characterized mainly by widespread musculoskeletal pain. But yeah, from the infographic, you can see that it's so much more than that as well. Fibromyalgia affects around 5.4% of the UK population, and there have been some risk factors and triggers that are linked to symptom flares as well, like smoking, high BMI, and physical and mental stress. Um, so it's also a clinical diagnosis because it lacks any sort of definitive diagnostic test, and its identification relies mainly on clinical expertise and, an assessment of the symptoms at hand. And because how it can present can vary so widely, it further, complicates diagnosis, and there's also kind of ongoing gaps within the medical community about, what fibromyalgia is and how to manage it as well. So this can lead to delays in diagnosis and management. I'll just let you read this slide in the interest of time. It's just the current management and challenges of fibromyalgia management. But lifestyle medicine can offer ways in mitigating some of these challenges, or even to work alongside already effective management options to further improve kind of overall health and quality of life. So the first pillar I will discuss is physical activity. We know that individuals who are inadequately active face 20 to 30% higher risk of mortality compared to those engaging in sufficient regular physical activity. And in fibromyalgia, increased sedentary behaviors and low physical activity are often associated with greater disease severity as well. So currently, the NICE guidelines recommend supervised group exercise program to manage chronic primary pain. And this initial supervision helps to educate patients and encourages them to continue the taught activities outside of the program. So these can include cardiovascular conditioning, exercises, or strength or resistance training, flexibility, proprioceptive exercises, and there's also a wide body of evidence to support the efficacy of aerobic exercises to improve pain, fatigue, and low mood, as well as overall fitness in fibromyalgia. And even if patients can't commit to a full exercise program, small frequent activities like gentle stretching or short walks can also be effective, which is especially important when like physical, financial, or temporal barriers make structured activities less accessible. So the key message to patients should be to find something they enjoy and to start small because any movement is better than none. And then over time, hopefully this can lead to improvements in various symptoms as well as, other like overall health and physical health and mental health parameters. The next pillar is sleep health. So people with fibromyalgia often report difficulty in falling asleep, maintaining sleep, and not feeling rested, even after a full night in bed. And this poor sleep is associated with increased symptoms of generalized pain, memory difficulty, and irritable and anxious moods. So one strategy we're taught as medical professionals is to encourage patients to adopt good sleep hygiene practices, which are just simple measures that consist of optimizing the environment for a better night's sleep and reducing exposure to activities or substances which are known to disrupt sleep quality. And I've listed some in this slide. And then additionally, another systematic review has found that aerobic exercises and meditative practices such as Tai Chi, Qigong, breathwork, and body scan meditation can also be beneficial to improve sleep quality. So suggesting that even short sessions of these guided relaxation techniques can help calm the mind and prepare the body for rest. The next pillar is healthy relationships. So there's a higher prevalence of loneliness among those with chronic pain. And loneliness has a negative impact on both physical and mental health, as well as being associated with an increased all-cause mortality. And people with chronic pain can often avoid social activities due to the unpredictability of pain flares or discomfort. And in fibromyalgia, negative thought patterns about pain may increase when feeling alone, leading to, further worsening of the existing pain. I found very few studies actually focusing on how social relationships can influence fibromyalgia like symptoms and disease progression. So I think there's scope for further research surrounding this, but it would be beneficial to encourage healthy relationships due to the evidence of social connection to alleviate mental health burden, and maybe also the potential for making other resources like social prescribing or peer support groups for fibromyalgia more readily available so that patients don't feel as isolated in their diagnosis, and have a way of, connected and sharing their thoughts with other patients. So the next pillar is that of healthy eating. So the British Society of Lifestyle Medicine advocate for a diet high in plant-based foods and low in ultra-processed foods. And one survey found that common aggravators for pain and fibromyalgia included meat, coffee, sweets, and chocolate. So it would be reasonable to suggest that patients keep a food diary to identify triggers and to avoid less nutritious ones under supervision. There have also been some studies looking into the effects of uncooked vegan or vegetarian diet on fibromyalgia symptoms. And although these studies were of low quality and quite, restrictive and not very practical, they do highlight or suggest the potential role of avoiding or cutting down ultra-processed foods and incorporating more nutritious anti-inflammatory foods into the diet for improved pain, sleep symptoms, as well as other physical health markers. But again, there is a need for high quality research looking into the role of things like the microbiome, dietary patterns, and nutrition, and how this can influence fibromyalgia. So the second last pillar is minimizing harmful substances. So I mentioned earlier that smoking is a risk factor for fibromyalgia, and studies show that smokers experience worsening pain compared to non-smokers with fibromyalgia. And as the number of cigarettes used per day goes up, so too does the pain severity and function impairment. So this can worsen with higher cigarette use. Um, when discussing alcohol consumption, patients who consume low to moderate alcohol actually showed improved symptoms and quality of life compared to those who did not drink alcohol. So while this can be connected to an improvement in symptoms, it also carries the risk of developing an over-reliance on alcohol or other substances for symptom control. So it's important as healthcare providers to be aware of this and screen for and monitor patients to prevent harmful behaviors. And then finally, in the section, medication misuse might also be a concern. So although there are guidelines in place regarding pain prescribing, sometimes they might not be adhered to, or maybe in other parts of the world where guidelines are not as robust. When it comes to the management of chronic pain, certain medications like opioids may be prescribed incorrectly or not under close supervision, which can carry risks of tolerance and at the extreme end also dependence. Um, so I think it's just important to inquire about these factors and prevent avenues into reliance. Um, Even if they do have the potential to alleviate fibromyalgia specific symptoms, they can cause harm to overall health. And then lastly is the pillar of mental well-being. So we know that fibromyalgia carries a variety of mood symptoms and some mental health disorders that coexist, like depression and anxiety mainly. And the current management includes antidepressants and CBT. So CBT in particular is great because it's not only effective in reducing key mood-related symptoms, but also has the added benefit of reducing the perception of physical pain. And also because of the learned techniques, there's a long-term effect of learning how to cope and reframe negative thoughts, which equips patients for managing other day-to-day life stressors as well as their fibromyalgia-specific symptoms. Um, I'll just maybe skip the role of physical activity because I'm sure you're all aware of the benefits of that. And then another one that I really enjoy is spending time outdoors in natural landscapes. So I think there are a lot of studies that investigated the benefits of natural areas for improving mood and reducing anxiety. And that you can also incorporate other pillars like physical activity or spending time with friends and family in these areas, and they're often accessible at low or no cost basis, which can contribute hugely to improving mental well-being as well. So in conclusion, lifestyle medicine intervention takes into account individual patients' circumstances and needs, but it's important to recognize that patients can face barriers like economic constraints, limited access to resources, or challenges in adhering to the lifestyle modifications, and addressing these will require multidisciplinary team effort to come up with tailored kind of strategies to ensure that these changes are realistic and attainable. Um, the six pillars are all interconnected and have the potential to influence each other positively, and it's important for medical professionals to communicate the evidence surrounding lifestyle and behavior changes to patients in a safe, evidence-based, and guideline-supported framework. But before such guidelines can be put into place, there needs to be a good evidence base that proves the safety and efficacy of such interventions, which is currently lacking in a couple of the pillars that I mentioned. So when it comes to nutrition or social connection, so there's area for improvement on that. And lifestyle medicine empowers patients to actively participate in their own health with professional support and can emphasize non-pharmacological strategies, which can complement medical treatments as well. And finally, when implemented in a guided manner, lifestyle medicine poses very low risk and offers huge benefits, not only for the fibromyalgia specific symptoms, but also for preventing future comorbidities. These are my references. I have quite a lot. Thank you.
Thank you again, Rakita. Okay, have we got any questions for Rakita? Ritika? John? John? Just unmute yourself.
Okay.
Yeah.
Okay. I thought that was very, very interesting. Thank you very much, Victor. I think it's what a lot of I wasn't aware of the concept of lifestyle medicine before, and I am now. And a couple of things. First of all, I think that lifestyle medicine is very similar to pain management has a lot of similarities. Not it isn't similar. Has similarities to pain management program therapy, which we do as a group multidisciplinary treatment for our patients. And also it's very much what's being recommended at the moment for everybody, isn't it? It's everybody is recommended to sleep well and be active and have good relationships and eat well and not drink too much and sort of look after themselves mentally. And it's I just wonder how you would be able to institute this with somebody. Say you had somebody with fibromyalgia. Do you have any feel for how you would make this happen for them? How you would introduce this to them and get them involved in it? Are there any particular ways of doing it?
I think for like how I wrote it was thinking from a primary care perspective, because that's kind of the first point of contact. I was thinking of ways in managing, all these different ways of managing symptoms or trying to manage symptoms and overall health before they're maybe referred to more specialized places. I think just making patients aware of, again, how it directly relates to their conditions and using the evidence to support that and encouraging them to at least try, because even if, for that individual, the symptoms don't develop to, say that it will have an overall health benefit. I don't know, I think small changes, but I don't have a revolutionary answer, I think.
I think, like John said, we do include a lot of elements of that. Things that we don't perhaps include is things like the healthy eating and the guidance around drinking, smoking, perhaps in the same way. Madeline?
Thank you. Yeah, really, really interesting. Again, I wasn't aware of lifestyle medicine in this sense, but I did see a lot of crossover with the pain management programs. But I was just really, it's kind of more of a comment really than a question, but I was really interested in the lack of evidence for social connection, because I think we'd all probably say anecdotally that we feel that that's a factor when we meet people in our service, kind of what social support they've got or sort of family, but also that wider sense of how engaged are they in the community. And I just thought it was really interesting that there doesn't seem to be sort of evidence as such to say that. I don't know if you've got a sense of why that is. Is it just too broad a thing for studies to have kind of captured, or?
I'm not too sure. I think maybe no, I'm not too sure, but I do know that maybe that could be a reason for, in addition to the financial aspects of it being a group exercise program, so it's also, a way for people to come together and, do these things together, but I'm not sure why there's
Just feels like
certain ways.
it'd be useful to capture, and
Yeah, it
definitely I
would.
feel like with our programs that is, that's another part of it, isn't it?
Yeah.
That the social connections,
Or
it's
even having like a small pilot study of, people's experience if you did set up like a support group or things like that.
yeah, because I'm sure there's loads about. It's just interesting that it's not kind of being captured, isn't it? But thank you, that was really interesting.
Thank you. Any other questions or comments? Okay, so want to just thank all the essay winners. Okay, I think